Jonathan Rosenberg from Memorial. Thanks for joining us in Nashville at Your Amigos Live. It's great to have you here. We just finished a very robust bladder cancer session. There was a lot of talk about Enfortumab Vedotin or EV. Talk us through, you've been involved with that drug's development. Talk us through monotherapy and then some of the combination data.
Thanks so much, Brian. It's great to be here. Enfortumab Vedotin was initially approved in the second and third line setting based on first response rate and then improved overall survival. It was tested in second line setting after PD-L1 inhibition in cisplatin-ineligible patients, and that showed a response rate of 52%, about 40 to 44% in the third line setting. In the first line setting, the data reported at ESMO 2022 showed a response rate of 45% in cisplatin-ineligible untreated patients. EV-Pembro, the combination therapy, was also tested in the first line setting in cisplatin-ineligible patients, and there were two trials that have been reported. One is EV-103 cohort A and EV-103 cohort K. And in cohort A, it was a single-arm study, showed a response rate of 73% in this cisplatin-ineligible patient population, which was really unprecedented, led to the FDA breakthrough therapy designation. The confirmatory study is cohort K, randomized to understand the contribution of components to EV and EV-Pembro, so EV monotherapy or EV-Pembro.
So it looks like that drug is moving forward in combination with Pembro as perhaps the most robust combination. Talk to us a little bit about the pivotal registration trial and maybe some other trials that it's being studied in.
So the confirmatory trial for cohort K is EV-302, comparing EV and pembrolizumab versus standard chemotherapy, either gemcitabine and cisplatin or gemcitabine and carboplatin in platinum-eligible patients, so all comers, mostly in the first-line setting. And it's also being tested in other disease states earlier as well in randomized trials. Pre-cystectomy, either against cystectomy in cisplatin-eligible patients or compared to gemcitabine and cisplatin chemotherapy in cisplatin-eligible
And just to wrap up, your confidence level 1 to 10 that the registration study will be positive and lead to approval?
I think about an 8.5.
Awesome. Thanks for joining us.